Assalamu alaikum wa rahmatullahi wa barakatuh. I am Dr. Hinda Hassan, Assistant Lecturer of Human Anatomy and Embryology. Inshallah, we will carry on the practical topics of neuroanatomy, and the topic to be discussed now will be the cerebellum and the fourth ventricle. Firstly, let's remember from where the cerebellum develops. Cerebellum develops from the dorsal part of the mesencephalon, and the fourth ventricle is the cavity of the hindbrain or the rhombencephalon. What about the cerebellum regarding the site? Look at these views. This is a sagittal section in the brain. We will find one cerebellar hemisphere, and we will find a cavity between the cerebellum and the pontine tegmentum, ventrally also the open medulla. So we have a cavity called fourth ventricle, lies between the pontine tegmentum and the open medulla ventrally, while the cerebellum will be dorsally. This cavity is the fourth ventricle or the cavity of the hindbrain. The cerebellum is located in the posterior cranial fossa. Look at this model. This is the cranial cavity showing the three fossae. This is the anterior cranial fossa. This is the middle cranial fossa, while this is the posterior cranial fossa. Posterior cranial fossa is called cerebellar fossa because it lodges the cerebellum. Cerebellum here, we will put the cerebellum. Here the cerebellum is located in the cerebellar or the posterior cranial fossa, and cerebellum in this fossa will be separated from the superiorly located cerebral hemisphere by a transversely located dural fold. This dural fold is called tentorium cerebellar. So this fold separates the superior surface of the cerebellum below from the inferior surface of the cerebral hemisphere above. Look at this. This is the cerebellum below the tentorium cerebelli. Okay. What about external features of the cerebellum? When you look at the cerebellum, we will find it divided by depressions called fissures. And also the surface shows areas in between these fissures are called folia. So the surface of the cerebellum shows depressions and elevations in between. The depressions are called fissures, while the elevations in between are named folia. The cerebellum is formed of two cerebellar hemispheres and a midline portion called vermis. And also the cerebellum shows two notches. Anterior notch surrounds the midbrain, and posterior notch related to a vertically located dural fold called falx cerebelli. Okay, so when we look to the superior surface of the cerebellum, we will find a view. It is different from where we are looking to the inferior surface of the cerebellum. These are the two cerebellar hemispheres and the midline vermis, and also these are the two cerebellar hemispheres and the midline vermis. What is the difference between the superior vermis and the inferior vermis? Superior vermis is not well demarcated from the surface of the cerebellum. It is composed of 5 lobules, while the inferior vermis lies deeply in a groove called vallecula, and it is composed of only 4 lobules. So totally the vermis is composed of 9 lobules. All the lobules of vermis, superior and inferior, are usually continuous with areas in the cerebellar hemisphere, except one of the lobules of the superior vermis. So when we are looking to the 4 lobules forming the inferior vermis, they are arranged from anteriorly backward as nodule, uvula, pyramid, and tuber. We will find that nodule is continuous with the folliculus. Also, uvula is continuous with the tonsil of the cerebellum. This is the cerebellar tonsil. So let's see a model to see the shape of the cerebellum and these external features. Look at this model. This is the cerebellum. This is composed of 2 cerebellar hemispheres and the midline portion. We are looking at the superior surface of the cerebellum. How we know? This is the superior vermis. It is not well demarcated from the surface. Look at the surface of the cerebellum. It is divided by grooves called fissures, and the areas in between these fissures are called folia. Now we are looking at the inferior surface of the cerebellum. This is the inferior vermis. It is composed of 4 lobules. It lies deep in groove called vallecula. The 4 lobules of it are called nodule, uvula, pyramid, and tuber. Let's see nodule. Nodule is continuous with the folliculi of the cerebellar hemisphere, while uvula is continuous with the cerebellar tonsils. While we are looking to the cerebellum, again, we will find anterior notch surrounds the midbrain and posterior notch related to a dural fold separating the 2 cerebellar hemispheres named falx cerebelli. We look at the cerebellum from the superior surface, and this is the inferior vermis. This is the inferior surface showing the inferior vermis in the vallecula. What about the anatomical loops? Cerebellum is divided anatomically into 3 loops by 3 fissures. The first fissure, it's called horizontal fissure. It runs horizontally to separate the superior surface from the inferior surface. And on the superior surface, we will find another fissure named as the primary fissure. And in the inferior surface, we will find another fissure called a posterolateral fissure. By these 3 fissures, we will divide the cerebellum into 3 anatomical loops. The first one is called anterior loop. The anterior loop is anterior to the primary fissure, while the next loop will be the posterior loop. This is the loop between the primary fissure and the posterolateral fissure. And the last loop will be the folliculonodular loop. Folliculonodular loop is formed of the nodule and the folliculi. So we have 3 fissures, one separating the superior from the inferior surface, another one runs on the superior surface, and the last one runs on the inferior surface. What about the 4th ventricle? According to the site, in this sagittal section, we will find the 4th ventricle lies between the cerebellum dorsally and the open medulla and the pontine tegmentum ventrally, as we said before. What about the shape? This is the 4th ventricle. It is rhomboidal in shape. So, what about the communication of the 4th ventricle? We will find the 4th ventricle communicating superiorly with the cerebral aqueduct of Sylvius. It also communicates inferiorly with the central canal of the spinal cord, while laterally it communicates through its lateral angle with the subarachnoid space. What about the choroid plexus? The choroid plexus is a structure should be present in any ventricle for secretion of CSF. The choroid plexus of the 4th ventricle is T-shaped structure. This has a stem, and this stem will be attached to the inner aspect of the roof, and we will know where. And it has 2 limbs, and the limbs project through the lateral angle of the 4th ventricle into the subarachnoid space, because the lateral angle is perforated by foramina of Loschka, and through this foramina, the limbs of the choroid plexus project into the subarachnoid space. Here is the rhomboidal shaped 4th ventricle. Here is the T-shaped choroid plexus attached to the inner surface of the roof. What about the boundaries of the 4th ventricle? The 4th ventricle laterally is bounded by, superolaterally we will find the superior cerebellar peduncles, while inferolaterally we will find the inferior cerebellar peduncles, and in the middle we will find the lateral angles. What about the roof and the floor? We mentioned the floor before. The floor is made by the pontine tegmentum or the dorsal surface of bones, as well as the open medulla or the dorsal surface of the upper half of the medulla, and in between we will find these transverse fibers which were called the stria medullaris of the 4th ventricle. So there are 3 structures forming the floor. Above we have the pontine tegmentum, in the middle stria medullaris of the 4th ventricle, and below we will have the open medulla. What about the roof? The roof also is formed of three structures. Firstly, we will have a membrane closing the gap between the two superior cerebellar peduncles. It is named the superior medullary velum. Also, we will have a membrane closing the gap between the two inferior cerebellar peduncles, this violet one, which is called inferior medullary velum. And also in the middle part, we will have the part of the cerebellum forming the roof. So the roof is formed of also three structures: superior medullary velum, part of the cerebellum, and inferior medullary velum. And here, if you look well, you will find the stem of the choroid plexus is attached to the roof. Where exactly? It is attached to the inner surface of the inferior medullary velum. This specimen shows the cerebellum from its superior surface. How we know that this surface is the superior? Because this midline portion, which is called the vermis, is not well demarcated from the surface, so this will be the superior vermis, which is formed of 5 lobules. What about this fissure? This is the horizontal fissure separating the superior surface from the inferior surface. What about this notch? This will be the posterior notch, which is related to the falx cerebelli. While the anterior one will be the anterior notch that surrounds the midbrain. What about this loop? This will be the anterior loop. Thank you.